Imagine having a chronically upset stomach, which results in you curling up in the fetal position and being incapable of focusing on anything else that is occurring around you. In addition to your moments of debilitating pain, imagine having to sprint to the bathroom 10 or more times a day just to vomit or pass loose bloody stool, and, unfortunately, due to your symptoms, you are incapable of going to the movies with your friends or out to dinner with your family. Oh, and not to mention, there is no cure or effective treatment for your symptoms. This is the daily life of patients with inflammatory bowel disease, or IBD. And not only is it physically, socially, and emotionally draining, but it also increases your risk of developing intestinal cancer. Fortunately, scientists believe they have discovered a new avenue which could be useful in treating IBD as a whole. Inflammatory bowel disease has two different forms: Crohn's disease and ulcerative colitis. The main difference between these two types of IBD is that ulcerative colitis solely affects the tissue lining the colon, whereas Crohn's disease affects tissues comprising of the entire digestive tract. Ulcerative colitis received its name due to the development of ulcers along the insides of the colon, which can burst open, causing extreme pain. Also, the open sores which are left after the ulcers pop increase one's risk of infection during bowel movements. Although we don't really understand what causes either form of IBD, scientists have been able to identify what happens to the body once IBD symptoms start occurring. In IBD, the body's immune system, which normally protects us from bacteria and other disease-causing microbes, attacks the healthy cells that line the digestive tract. This attack causes inflammation, which often leads to the vomiting, loose stools, and stomach pain mentioned before. In recent studies, scientists have reported that the severity and duration of IBD symptoms drastically increase a patient's chances of developing intestinal cancer. From these findings, scientists highlight the fact that if we were to create a therapy that could reduce the amount and duration of inflammation in the colon, we would then also decrease one's chances of developing colon cancer. In one study, researchers found that the hormone estrogen may actually be acting as a protector of the lining of the colon by suppressing the immune system when it begins to flare up and attack our own cells. Now, you may know estrogen as the female hormone. However, as it turns out, estrogen actually plays an important role in the bodies of both males and females. You see, hormones act like a signal, and in order for our tissues to respond to that signal, they must have a way of recognizing it. And in the colons of our bodies, there's a certain estrogen receptor called estrogen receptor beta that blocks the inflammation that causes IBD and colon cancer. Scientists were able to discover this effect of estrogen receptor beta by experimenting on mice that did not have the estrogen receptor. And by inducing mice without the estrogen receptor with a serum that caused inflammatory bowel disease and intestinal cancer, they saw that compared to mice that had the estrogen receptor, mice without the estrogen receptor beta were actually more likely to develop cancer due to the inflammatory bowel disease symptoms such as increased inflammation. Looking into this a little bit further, scientists wanted to understand exactly how estrogen and its receptor beta were decreasing the rates of inflammatory bowel disease and cancer in mice. And upon further investigation, scientists discovered that mice without beta actually displayed increased levels of inflammatory markers. And the inflammatory markers, which were found in the blood of these mice, have all been identified as known causes of cancer. Scientists believe that by regulating these pro-inflammatory markers with estrogen receptor beta, we can significantly decrease the rates of colon cancer. However, the correlation that we're seeing between estrogen receptor beta and the decrease in cancer is not an open and shut case. The pro-inflammatory markers that were discovered in this study are not the only molecule known to stimulate the same inflammatory response in the body. In fact, there's actually a vast amount of different molecules and biological processes in the body that stimulate the same response. However, this discovery is an optimistic one. Although there are many other different avenues through which the body can stimulate this inflammatory response, this discovery has truly broadened the scope of treatment for both patients and doctors. Although there is still very little known about the cause of inflammatory bowel disease, experiments like this one truly emphasize the importance of discovering new avenues for treatment, such as estrogen and the receptors in our body, and how they can reduce a patient's chances of developing colon cancer. By continuing to prioritize and focus on IBD as a local and global health concern, the days of chronic stomach aches, constant running to the bathroom, and social embarrassment that IBD patients experience every day of their lives may soon be coming to an end. Thank you. I hope you enjoyed it.